Let me feel underneath your arm.
It's a uniquely American problem. The richest country in the world leaves tens of millions with no health insurance.
It makes me feel that we don't matter.
The thing about surgical theater
a country with such remarkable innovation.
They don't know a discharge date.
And yet so many are struggling.
Every one of us can name some people we saw suffer to death.
You know, the deck's stacked against you.
This is America's day.
As a new administration takes over, promising reform, we travel to 4 very similar nations with 4 very different health systems for clues.
I love how open and explicit they are about the fact that there are always choices.
Did you have a good sleep?
How do they care for virtually everyone and do it for less money?
No one says, well, that's going to cost too much, so we're not going to do it.
Here it's a bit more humane. It's like, look, you know, there's a basic level of care that people deserve. It costs, but you still deserve it.
And amid a pandemic, does universal coverage help save lives?
If you require an ICU stay, if you need to be intubated and ventilated, all of those things are covered under the public system.
We have a problem. What lessons can we learn from abroad? Critical Care, America versus the world. I'm William Brangham, and our first stop is Houston, Texas. There, we met a little boy saved by American innovation. A bouncing, rocking, joyful testament to the miracles of modern American medicine. His life was transformed here in what's called the largest medical city in the world, the Texas Medical Center in Houston. Here, doctors test artificial organs built from scratch. Technicians design robots to speed efficiency. Surgeons use virtual reality reconstruction to see tumors inside the body before ever making an incision. And kids like 5-year-old Kaysen Cox come back from near death. Kaysen was born with only half his heart functioning normally. Those hints of blue in his skin, a sign of a little body hungry for oxygen. Most kids with this condition don't live very long.
I can remember it perfectly. It was pouring rain outside, of course, and I was by myself, and my doctor told me that she sees that Kaysen's heart is underdeveloped. It was a very few dark days for me.
But using new and highly complex surgical techniques, Dr. Jorge Salazar, that's him on the right, changed the course of Kaysen's life.
Kaysen was going to die. And had we done what we've always done, he would have had a transplant already, or it's a hard thing to say, but he would have passed away already. But now we have a normal child in front of us.
Dr. Salazar came out with the biggest smile on his face, and he said, I did it, you did it, he did it, and it worked. So, I think we all started crying.
You got it? Kaysen Cox is one story. The Texas Medical Center performs over 180,000 surgeries every year. It, along with other gold standard medical centers across the U.S., draw hundreds of thousands of patients from around the world. The technologies and innovations created in the U.S. also get exported globally.
You see what your options are around here. You just pass.
But just a few miles away, it's a world apart. In North Houston, the mostly low-income residents here experience a very different healthcare story.
I want you to see that within just a few miles, you have the very best and the very worst. And it's just not fair, and it doesn't have to be that way.
Elena Marks is the president and CEO of the Episcopal Health Foundation, and last year she took us on a tour. Her foundation analyzed CDC data documenting widespread disparities in this area.
They don't know a discharge date right now.
She pointed out that the mostly black residents here are disproportionately uninsured. They often don't get good care until it's too late. They die, on average, 20 years earlier than residents in other parts of Houston.
You know, the deck's stacked against you. If you could get to the medical center, that would be great, but you'd probably be really sick because of the neighborhood you live in by the time you get there.
We started filming this program last year when China was dealing with an explosion of this mysterious new coronavirus. But at that point, only a few travel-related cases had been found in the U.S. Still, many residents in this part of Houston, like Ruby Glass, whom we met at her home with her mom, knew that if the virus landed here, these disparities would hit communities like hers the hardest.
Can you imagine that if that were to hit in my community, a lot of us don't have insurance? Where do we go?
Don't start.
Okay, Liam.
Can you get the mask, please?
Like this seizure.
No, I can't have that on, not on the nasal cannula.
Go on,
Turn it down.
You're all right. Come on out of that.
Dozens of times a year, episodes like this will send Liam to the hospital. He is always at risk of dying.
Good boy, Anton.
Liam's life and the incredible care he gets are a testament to the United Kingdom's National Health Service, known as the NHS. Residents of the UK pay taxes to the government that support the NHS. The government is then the single payer for healthcare. It pays doctors and hospitals and covers nearly all costs.
Seatbelts on.
For Liam, that's all his medicines and hospitalizations. It pays for caregivers that come several times a week. The NHS even paid for this chair and standing frame to help him exercise.
He's been out for about half an hour now, hasn't he? So that's really good, Liam.
No one says, well, that's going to cost too much, so we're not going to do it.
You've never heard those words?
No, and if we call an ambulance will be here in 5 minutes to pick Liam up and take him to hospital. The specialist team will come out, pick him up, put him on their ventilators, take him to intensive care. An intensive care bed will cost £2,000. No one mentions the money. They just do what you need to do. Without the NHS, we would be bankrupt. Liam would probably be not with us.
On July 5th, the new National Health Service starts.
The National Health Service was built from the wreckage of World War II, something of a gift from the government to a battered and impoverished nation which welcomed it. And today, it's still considered the UK's great equalizer.
Okay, Dolores, do grab a seat.
Everyone, regardless of profession or income, has access to that system, from primary care to, as needed, the full range of specialty services.
Try and let me just take the weight.
Patients' point of entry to the system is through their general practitioner, doctors like Sam Everington.
There's no cost attached to going to see a doctor in this country at all. And that's really powerful.
Do you ever think about how much things are going to cost when you come to the doctor?
No, it doesn't cross my mind. But the thing is, because I'm diabetic, in England, if you're diabetic, your prescriptions are free, so I don't have to pay for it anyway, so it doesn't cross my mind.
Despite those benefits, per person, the NHS spends less than half what we spend in the US, including a lot less than we do on administrative costs. And the NHS generally gets better health outcomes than we do. Life expectancy is longer here than in the US, in part because people in the UK suffer much lower rates of chronic diseases like diabetes and hypertension.
It's hard to overstate just how beloved the National Health Service is here in the UK. Some people have referred to it as the closest thing this country has to a national religion. In fact, in 2018, when the service had its 70th anniversary, they had a huge celebration here at Westminster Abbey.
We were in the UK in the early days of the coronavirus's spread. The WHO had declared it a public health emergency. The US had only a handful of confirmed cases at the time. Cases would soon surge in the UK, and when they did, a big part of the government's stay-at-home appeal was protect the NHS.
Families every day are continuing to lose loved ones.
But even so, when we were there, we heard of growing disillusion with the system. In the rural town of Dorchester, England, we met 77-year-old Olive Parfitt.
I was supposed to have the operation in August, and 14 hours before the operation, they cancelled it.
Parfitt needed to have her knee replaced, but she'd been on a waiting list for nearly a year. She said she took 4 painkillers just to take this short walk around her housing complex.
Because I've walked so badly for over a year, I'm starting to throw the other knee out.
Oh, really? Because you're compensating?
Yeah, so you wobble. If I have a heart attack tomorrow, it's the best thing. They will take me in. They will do it. But when you've got what I call disabilities that are not life-threatening, they can't cope.
Parfitt has been a strong supporter of the NHS her whole life. But now, after a lifetime of paying in, she feels left out.
I started working at 15. I didn't have time off to have children. I pay for schools I haven't used. I've done it willingly.
Most medications outside the hospital aren't covered, but supplemental insurance, which most people get through their work, picks up the slack. During the pandemic, Canada has had much better outcomes than the U.S. Its overall death rate is about 3 times lower than America's.
So we have built quite an effective system within Ontario to respond to COVID-19.
Dr. KIERAN Moore is the head of public health for Kingston and the surrounding region in southern Ontario. This holiday destination could have easily become a COVID hotspot, but this area of roughly 200,000 people has had only 1 death during the whole pandemic.
That's the benefit of having a universal healthcare system, because all partners are working together. There's not a private-public separation of responsibility.
Well, that's in her period of acquisition, and you said that was a week and a half ago?
The program for the poor. Texas, Florida, North Carolina, and Georgia have not expanded Medicaid. So if we get 1 or 2 or 3 or maybe all 4, then we would have made big strides towards covering many more Americans, millions.
Look, we may never get to 100% coverage, but these policies alone can get us above 95, 97%. It's pretty good. That's pretty good. And if we can do that and strengthen the ACA, we will be as close to universal coverage as the U.S. is likely to get.
It extends coverage and lowers healthcare costs for so many Americans.
Inside the enormous COVID relief bill signed by President Biden recently are provisions to strengthen the Affordable Care Act and encourage more states to expand Medicaid. But the ongoing political battle to adopt further changes in both Washington, D.C. and in state capitals is a major one. It was a major battle in these other nations as well, but their experience shows that achieving universal coverage is not an impossible task.
Hi, so nice to see you.
Just recently, we went back to Houston to check in on someone.
It's good to see you too.
It's been a full year since we first met Lakeisha Parker.
You look fabulous.
I feel good and everything is well. A lot has been going on since the last time we met.
Parker is out of the homeless shelter and in a new apartment. She proudly gave us a virtual tour.
Welcome, welcome, welcome. We're walking in. The kitchen is to my left. My mask, of course. This is just my living area. Cute enough for me. My bedroom. So grateful to decorate it the way I like it.
Lakeisha, the place looks fantastic.
A great space. Yes, it is.
So you were in the shelter when the pandemic hit?
We were literally in the shelter when we came up on shutdown.
Parker's back on her feet again after landing a job at an Amazon warehouse. It's hard physical work, but she says she can do it for now. And she's got health insurance.
The last time I talked to you, I was homeless. Since then, I have been blessed to work my way back to living life as what I feel is a productive citizen. I have keys to my apartment. I was helped to get keys to a car. So things have changed dramatically. They have really been on the upcline. So I'm grateful. Even though we suffered a lot of things.
I'm glad for finally some piece of good news coming out of this year.
For somebody.
One life changed for the better. Tens of millions more are still in limbo. Parker thinks America's health system can change, but moving in the right direction, helping those in a tough spot avoid the struggles she's seen simply because of one diagnosis, that's the task ahead. But she has hope.
Good things do happen. It can't be like this always. My life is a testament of that. Homelessness, bad health. But the sun is literally shining in my life today, and I'm grateful. I'm very grateful. So this too shall pass. This too shall pass.
Sun literally comes out as you say this.
Yes. It won't be like this all the time. This too shall